Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update, or maybe general update, on Wednesday the 6th of April 2022. And I want to start by talking again about the pressures on the NHS system. I mentioned this last week. On Sunday afternoon, we declared our highest level of internal escalation as a trust because of enormous pressure on our A&E department and then through into the main part of the hospital. We were in a situation where every single one of our beds within the hospital was filled with a patient. So patients were backing up in our emergency department, and we needed to take some additional internal measures to address that. So that's called OPEL 4, and we're in that status now since Sunday. What it does mean is that we have stepped down some routine clinics and actually stepped down some routine surgery. I'm sorry to put it like that because it's never routine for the people who are involved, but what I mean is non-urgent surgery. And so I apologise to anyone who has been inconvenienced by that, but we needed to move clinical staff to the front line to deal with the situation. And we continue to do that, but of course we review it multiple times throughout the day. So what it means is there have been and continue to be long delays in our emergency department. We're working as hard as we can to make sure that ambulances can offload, and we've been cohorting patients in different parts of the hospital to deal with that. But as ever, I just need to get across the message that, of course, if you have an urgent or emergency or an accident, then that's what we're here to deal with through our A&E department. But to be thoughtful about other ways to access medical advice if needed, either through NHS 111 or through local pharmacies or through GP surgeries, to move that forward in the first instance. So thank you for that, and we'll keep working as hard as we possibly can to deal with that issue. So I want to say a massive thank you to all of our staff who are working extraordinarily hard to try and do the very best they can for our patients. I suppose a particular thank you to colleagues in the emergency department who really are under relentless pressure 24 hours a day and still maintaining good spirits and being as caring and considerate as is possible under the circumstances. Some of this is still a feature of COVID, and today we've got 124 COVID positive patients in the hospital, 115 in our general beds, 2 patients in intensive care and 7 in Clifton. So COVID positivity is still a big issue, although, as I've said before, not all of those patients who are COVID positive are here because of COVID. Sometimes for more frail elderly patients, COVID positivity contributes to the frailty and being poorly, but is not necessarily the principal issue. But nevertheless, of course, we're cohorting patients who are COVID positive and trying to restrict where we possibly can the risk of transmission of COVID across the hospital. And that, of course, is why even though we have reintroduced visiting, as I've talked about before, if you do come on site to visit a relative or a loved one, we ask that you wear a mask when you're on site and you abide by our internal NHS infection prevention and control rules. Please don't come if you are symptomatic with cold or flu-like symptoms, and ideally, if you could do a lateral flow test before you come and check you're negative, that would be perfect. Now, free lateral flow tests are now available online for NHS staff, but also any patients who are coming in for planned surgery. There's a particular box to tick, so that is one way that you can access free lateral flow tests still if you are due to come for some planned surgery. In the last 7 days, our data shows that we haven't recorded any new deaths linked to COVID within the last 28 days, although in the last 28 days we've listed 20 patients. So this data comes and goes a little bit, but the deaths in the last week with direct relation appears to have gone down. In any case, as ever, I extend my condolences to relatives and loved ones of those who've been affected. Just around vaccination, to still say we are doing the 4th booster, or I suppose it's the 2nd booster, but it's the 4th dose. So if you're over the age of 75, or if you're over the age of 12 and you know you are in an immunocompromised group, this 4th dose is now available. It can be booked online, and we are delivering those through our vaccination hub here at the hospital. So if you've not heard from your GP practice and you are in those categories, you can go online and move that forward. So final messages: NHS still extraordinarily busy. We're still trying really hard to get patients out of hospital who we believe are medically fit. We're not adding medical value to the stay. Our colleagues in social care are working ever so hard to find placements for patients. And if you are a friend or relative of people who are in hospital and you can help them to get back into their own homes, that's enormously helpful for them, but also for the whole system. So very grateful for that. And as ever, to say thank you for all of your engagement. Please stay safe yourself, and I'll update you again next week. Thanks.